participating in today's discussion, and especially the launching of N-SPRI, which is NIMHANS Suicide Prevention, Research, Implementation and Training Engagement. So this is something that I think is a wonderful initiative taken up by NIMHANS. It is a premier institute and it has got very intelligent and brilliant people working, and it's got a history and track record of handling mental health issues and issues concerning the aspects of neurology and so on and so forth. So for them to come out with this, I really welcome it. As a Health Minister of Karnataka, I think it's a wonderful thing that you're doing. And we all know, I think the awareness levels regarding mental health and depression, and ultimately those things leading to very calamitous results in terms of either
the young students here, some of the filmmakers, the art specialists who all try to work in this space of preventing suicide. I think it's a very, very important and momentous occasion here today that we at NIMHANS are launching the Welcome DBT N-SPRI. And you've heard about the fact that it looks at prevention, it looks at intervention, it looks at research, and it looks at policy to try and reduce, prevent suicide. This is the month of suicide prevention, and this year's focus is on young people. We've all heard about the staggering statistics of suicide, and that it's not just a global problem, but it's also in the country that we lose several more lakhs of people to suicide. The important thing is also that, especially this morning when we heard, suicide is an intensely personal on one hand, occurrence on one hand, but it's glaringly public on the other. And I think that's what makes it, in some ways, a very important issue to come together for all of us as a community. And you'll see here that there are a variety of people, not just mental health care professionals, but people working in the space, maybe from art, maybe from public health. And we were just discussing, I think Dr. Upendra just mentioned in the morning, that when we look at medicine now, you don't only look at it from the point of physical health. There are so many aspects of social health and well-being, environmental health and well-being, which are very, very critical. And therefore, to only look at it from one lens is inappropriate. There are a lot of social backgrounds to it. There are a lot of triggers to it. It's very well established that apart from mental health problems, it will be one part of the spectrum. There are, just living conditions like poverty, like domestic violence, like stress.
They can actually kind of develop this kind of interventions across India. And we also have around 13 PhD students who taken up PhD topics in the area of suicide and self-harm and suicide prevention. And we have a large number of pre-doctoral research programs, which all cumulatively led to a program. We thought we should have a center. So we call it as N-SPRI, and it's funded by, currently being funded under Welcome DBT India Alliance Center Grant. We thought Center for Suicide Prevention. Madam said, I think Madam changed the name. Madam said, I think it should be very, very broad name. So that I think she suggested, thank you for this name, ma'am. So she said it's a NIMHANS suicide prevention, research, implementation, training engagement. I think we are doing all of things, and it says as a visionary having.
Yet, in fact, I made him write, and I told him that you write down these are the things that you will not do. That was the first year. But yet, some of these things are addictive. And so, we really didn't know at any time, if at all we went into his room, because privacy is a big thing with today's children. I would see at least 5 or 6 screens open.
Of India to fund this project on suicide prevention, National Health Mission, Government of India was very happy. So they didn't even ask one question, so they just granted the funds. So usually when we apply to Government of India, they ask many questions: what, why, how do you. So no questions were asked, and we got the grant. And it's already, Anish has explained everything what we did. So around 8,000 suicide attempts in just 5 to 7 hospitals.
Education programs at different levels, and more importantly, each one of that should translate into preventing the lives of the precious lives. And again, I want to thank all the HODs and the faculties of various departments from NIMHANS. They are contributing, and a special thanks to the officials of Government of Karnataka for their support. I also want to thank the media and all the stakeholders who are here, and especially movies, show of the movies.